well, welcome everyone, and thank you for joining us today. We are so excited to have you here, and we're excited to be joined by Sherri and Elisabeth Mack. They are nurse educators and integrative care advocates, and we're so grateful that they are here to talk about this important conversation. They bring a wealth of experience, expertise, educational insights, and so much information that I'm very grateful they're here to share with us. A little bit of housekeeping before we get started, and I hand it over to them. The session today, it's going to be about a 60-minute presentation, and then we're going to have some Q&A. If you do have any questions as we're going, feel free to drop them in the chat. We'll do our best to address them at the end. You can also raise your hand, and we'll do our best to call on you and get as many questions answered as possible at the very end. And with that, that's really it from me. I will hand it over to Sherri and Elisabeth, and they can take the reins and get started.
Okay. Well, good morning. You should be seeing my screen share, and hopefully you are. Yep. Okay. So we are here to talk today about the therapeutic use of cannabis for palliative and end-of-life care. I'm Elisabeth Mack, here with my partner Sherri, and we are the founders of Holistic Caring and the Green Nurse and Bloom Hemp CBD. And I have had the pleasure of working with Dr. Bob since 2017, integrated MD care when I was his in-house cannabis nurse for a few years until I moved. And so now we're out in Palm Springs and we do everything remotely. So telehealth care for everybody in this country and actually even globally. So good morning, and it's a thrill to be here. We're going to show a quick video that is about what we do in this space, and just sit back and enjoy this for a minute, and then we will be right back in about a minute.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name, and she called me, and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.
Go. Growing your health, growing in cannabis. Yes.
All righty. So and a quick disclaimer, Holistic Caring and the Green Nurse and Bloom Hemp, our content is not to substitute for professional medical advice, nor has any of this been evaluated by the FDA, but we do hope to bring you hope through this presentation. Oops. There we go.
All right. Therapeutic use of cannabis and healthy aging with hemp CBD. So my introduction to cannabis as medicine came from Marianne. She was the person who introduced me to medical cannabis in 2012 during a time when I was sick and suffering and on over 18 pharmaceuticals. Very interesting story. She was 70-year-old retired nurse friend of mine who visited me when conventional care had failed me and I was struggling. She shared her wisdom and her cannabis harvest with me. She brought me a basket of goodies, offering me comfort and relief when I had none. And, she disclosed to me, she said, Sherri, get with the program. Cannabis has been around for thousands and thousands of years. And she disclosed to me that she had been using a little bit of cannabis every day since the age of 17, and she wasn't on any pharmaceuticals, nor had she ever been hospitalized for sickness. That's 53 years of using a little bit of cannabis. I had to take a look at that. She revealed to me that her father, a pharmacist, stocked cannabis in his pharmacy before 1937. And that's when prohibition hit, when they decided to take alcohol out of prohibition and put cannabis and hemp into prohibition. So here we are years later. I'm off of those pharmaceuticals, living my best life and helping others do the same. So my name is Sherri Mack. I've been a registered nurse for 37 years, 25 years in the conventional system at the big teaching hospitals in Boston, doing a lot of different things in my career: critical care, oncology, pediatrics, geriatrics, hospice and palliative care, home infusion, telehealth, 20 plus years in holistic nursing, and 10 plus years in the plant medicine arena, including cannabis and psychedelics. I'm grateful to be Chief Nursing Officer and co-founder of Holistic Caring and the Green Nurse, Vice President of Bloom Hemp CBD. I do have an award-winning podcast to share stories of healing. I do sit on a lot of different boards and founding members of different plant medicine organizations and nursing organizations, and I'm contributing author of Clark's Cannabis, a Handbook for Nurses, which is the first cannabis textbook to be published in the United States. Just to kind of set the stage for how and why we're able to educate on this topic.
And so I'm Elisabeth, and I've been a nurse 1 year longer, 38 years as an RN, spent my first 10 in hospitals, 19 after that in insurance company operations and sales once I got my MBA in healthcare administration. And what happened to me is I got hurt. I crashed my bicycle, went out on leave to have surgery, and my chiropractor's office introduced me to CBD, and I started to use it topically and internally, and I started to heal and said, I'm healing now better than I did with all of the conventional care and the pharmaceuticals. And I said, if I can help myself, I've got to help others. And I set up my own practice in San Diego, and fast forward to today, co-founder of Holistic Caring and the Green Nurse, Holistic Caring Inc., Bloom Hemp CBD. I was the past treasurer of the American Cannabis Nursing Association, currently director of health at LA Normal, and the Cannabis Alliance Network in Coachella Valley, and a very active member of the Society of Cannabis Clinicians, serving on several committees, as well as a corporate partner for the Aging Life Care Associates. And we enjoy being part of ALCA. Most of our work is with seniors. And of course, the author for Cannabis for Health, which came out a year before Carrie's Clark's. So yeah, mine actually was the first textbook. But so cannabis nursing, nobody's ever heard of it before, but nurses are the only licensed medical professionals publicly supporting cannabis. The ANA officially recognized cannabis nursing as a specialty nursing practice, and this book was published a year ago. This has been in flux the last couple of years, but for the past 20 years, the American Nursing Association has supported safe access to therapeutic cannabis and cannabinoids, and the AMA is still looking around the edges, because cannabis in the botanical form that we're going to talk about today is not FDA approved, and it's not always vetted, but it is safe in legal markets, and that's why we do what we do. So today, we're going to frame this conversation with the challenges that patients endure at end of life and in palliative care, and then we'll talk about how cannabinoids might be able to help bridge that. So pain and discomfort, whether it's from disease or the treatments, pain is a constant challenge among patients at the end of life, especially patients with cancer. Nausea and vomiting, it can be triggered by illness or chemotherapy, but it is distressing. It leads to dehydration, cachexia, wasting syndrome, and advanced illness, further weakening the body. Appetite and weight loss. Many diseases and their treatments can diminish appetite, leading to unintended weight loss, muscle loss, and weakness. Fatigue and weakness. Dealing with disease can be physically and emotionally draining, impacting quality of life, and exhaustion is always unwelcome at any stage of life. Breathlessness can lead to discomfort, anxiety, and a reduced ability to engage in even simple activities, significantly impacting our overall well-being. And questioning life's meaning and purpose can lead to overwhelming anxiety, panic, depression, overwhelm, and grief that can hinder ease and well-being during the death and dying process. So how might cannabinoids help?
Well, there we go. There is a solution, and we've seen it. How cannabis and hemp CBD can help at the end of life. So with that pain and discomfort, cannabinoids can modulate the pain response, decreasing inflammation and helping to decrease the need for high-dose opioids and their side effects. Cannabinoids blend very well with other pharmaceuticals. You just have to do it under the guise of a caregiver. Fatigue and weakness. Cannabinoids can modulate the stress response, decreasing stress response, prompting the relaxation response to help with energy expenditure. Cannabinoids and hemp CBD can relieve nausea and vomiting, allowing patients to eat when they want to. Cannabinoids can modulate hunger hormones, helping to increase appetite and the ability to eat when they want to eat, maintaining systemic homeostasis. Breathing difficulties. Cannabinoids can actually help promote the relaxation response, easing the effort of breathing. Cannabinoids are actually natural bronchodilators, opening up airways, allowing for better oxygen-rich blood to go through. And this actually decreases anxiety. We've seen this. Existential crisis. Cannabinoids can promote the relaxation response, providing euphoria when appropriate to ease burdens and the fear of dying. This allows the time for important legacy work to be done. There is nothing worse than a dysphoric patient. Dysphoria is a crime. Euphoria is not. Mental health, easing anxiety, depression, and panic around the end of life. Getting a good night's sleep, improving sleep at night and engagement in the day to do that legacy work so patients and families can have those meaningful conversations. And so this is how cannabinoids and from cannabis and hemp can do this. They have physical, mental, emotional, spiritual benefits. But on the physical side, it can balance the nervous system, immune function, balancing stress hormones, decreasing pain, neuropathy, and muscle tension, increasing mobility by reducing pain, increasing energy by reducing pain. And then mentally, it can improve quality of sleep, improving relaxation and calmness, and that feeling of well-being, decreasing fatigue, anxiety, and feelings of isolation, improving daytime energy, building resilience for empowerment, even at the end of life. So when you think about the relaxation response, when we're either in the fight or flight response or we're in the relaxation response bestows rest, repair, resilience. And this cultivates an opportunity for the mind, body, and spirit to heal, even at the end of life. Spiritual healing with cannabinoids is nourishment for the soul and for those at the end of life. And talk some research.
So now we're going to pivot into a few research studies, and this is a meta-analysis of medical cannabis, and it was just published last December, so just 6 months old. A review of studies on older adults reported significant improvements in pain and reductions in opioid use as benefits from medical cannabis treatments. In one study, over 70% of participants reported decreased pain and 94% felt their conditions improved after 6 months. Assessing median pain levels on a 0 to 10 scale, scores went from a median of 8 to a median of 4. Another large-scale Canadian survey found that 65% of older adults reported improved sleep. Qualitative research showed that older adults using medical cannabis were less likely to report problems with staying asleep compared with those not using medical cannabis, independent of potential confounders such as chronic pain and sleep medication. And in the Canadian survey, 53% of the older adults also reported improved mood after starting medical cannabis treatment. The study showed a significant reduction in real-time anxiety levels and a significant reduction of depressive symptoms after 3 months of medical cannabis treatment among middle-aged and older adults with chronic pain. And other studies they reviewed suggest that medical cannabis may be beneficial for behavioral and psychological symptoms of dementia, such as agitation, aggression, psychosis, and mood disturbances, with few safety risks associated with using low-dose THC treatments with dementia-affected older adults. And we'll get to a few of these in play in our case studies.
Yes, we will. And so this is another a cross-sectional survey in 2022, medical cannabis use in non-hospice palliative care. And so they did a sample size of 708 terminally ill patients that were enrolled in the Illinois Medical Cannabis Program. And the key findings demonstrated cannabis use to be associated with improved gastrointestinal symptom management, nausea, vomiting, motility issues. Patients using opioids and cannabis together reported greater pain reduction than those that were using opioids alone. The key findings also demonstrated an enhanced ability to manage health outcomes and also improved self-reported quality of life scores. So notable insights from this is that the botanical versions of cannabis were used by these patients, not the synthetic version. And there is a difference, and we're going to talk about that. Patients use medical cannabis outside formal palliative care programs, meaning that they did this on their own. And cannabis was perceived as an alternative to traditional palliative care, being seen as complementary. And the other thing to note is that the higher baseline pain was observed among those who both used cannabis and opioids. So those patients had higher pain scores that decided to use both the cannabis and the opioids together. So implications for cannabis nursing. So this reinforces the value of individualized patient-centered cannabis care planning and opportunities for nurses to support dosing and titration, and that's what we do. It also highlights the need for interdisciplinary collaboration to ensure cannabis is integrated safely and effectively into the palliative care approach.
And so now let's shift into talking about this marvelous healing plant. Cannabis is one of the richest plants on earth with over 1,500 natural compounds. And you can see the thick purple, sticky, stalky section of this plant is the flowers. The medicine is in those trichomes, the little resinous glands on the flowers, influenced by strain, soil, climate, and cultivation. There are cannabinoids, terpenes, flavonoids, canaflavins, essential fatty acids, all comprise the entourage effect, where the whole plant is greater than the sum of the individual parts. And cannabis is pleiotropic. And what that means is it may have effective efficiency to influence many physiologies and symptoms all at the same time, which you'll find out if I take this in systemically and I take a tincture, it can help my pain, it can help my mood, it can help my anxiety, it can help my lungs and my gastrointestinal issues, etc. And the phytocannabinoids from this plant mimic the endocannabinoids that we make upon demand to balance out our body. So what are cannabinoids?
So there we go. So cannabinoids are molecules that interact with the endocannabinoid system. And there's three types. Endocannabinoids we make internally. They're called endogenous internal cannabinoids. Anandamide and 2-AG are the examples. And then we have phytocannabinoids that are made by the cannabis and hemp plant. THC, CBD, and you're going to hear us talk about a lot of minor cannabinoids in upcoming slides. And then you have synthetic cannabinoids, which the pharmaceutical company makes, Marinol, Epidiolex, and Sativex. So cannabinoids are molecules that interact with the endocannabinoid system. THC and CBD are the phytocannabinoids from the cannabis and hemp plant that mimic our own internal endogenous cannabinoids to activate the endocannabinoid system. So the phytocannabinoids from the plant are 10 times stronger than the endocannabinoids that we make. So the phytocannabinoids last several hours when we take them, as opposed to the microseconds life. So in other words, the endocannabinoid system is going on and off all day long, just nudging those receptors. And you can see that THC and anandamide, THC the plant makes, anandamide we make, actually plugs into that nerve receptor to initiate a biological reaction, to tell the body to either do something or not do something. Generally, to correct the nerve cell receptor signaling to initiate a message to bring our body back into balance when it's out of balance. So the endocannabinoid system, I want you to all think of, we have receptors everywhere, and this is why I have this umbrella. The endocannabinoid system is the master regulatory system, keeping all of our other systems balanced. So the umbrella demonstrates the interconnectedness of all of our 11 body systems, our organ systems, and all of our neurotransmitter signaling systems. We have cannabinoid receptors on all of the cell surfaces of all of these different areas. So the endocannabinoid system blankets on top of our umbrella, and it's like a switchboard sitting on top of every other system, listening, sensing, and releasing endocannabinoids, steering our bodies back to balance. So just think about this. We are 30 trillion cells broken down into 11 organ systems, our immune system regulated by this master regulatory system called the endocannabinoid system.
And now we're going to just zoom in and take a look at a cell. So you can see here, this is the three parts. So we have receptors, endocannabinoids, and enzymes that break it down and synthesize these endocannabinoids. So anandamide and 2-AG are floating around from the postsynaptic back to the presynaptic, and they plug into the CB2 or the CB1 receptor, and they initiate feedback. And I call this feedback pharmacology because it's retrograde signaling. Normally, transmission goes from pre to post, but these send the messages back, sensing what's wrong, and generally they're downshifting. And CB1 is generally in the brain and the central channel, so our mind, our memory, our motor functions, our emotions, our temperature, our appetite, etc. And then CB2, think about the cells of your immune system and in the gut. And they're but there are receptors on just about every one of your cell surfaces throughout all of those bodies. But we run deficient. And the three components of the endocannabinoid system don't always work effectively. Messages don't get relayed, and the body malfunctions, hindering our ability to adapt to outside stressors, and we get sick. We get chronic conditions, neurodegenerative diseases, cancer, etc. The main cause of ECS deficiency is aging. Genetics can also accelerate that. Poor diet, lack of exercise, obesity, stress, trauma, poor sleep, smoking, drinking to excess, polypharmacy, and diminished social interactions, lack of love, touch, and laughter shut down this system. So we need to do what we can to balance it out and bring it back. And this is an example of the pleiotropic workhorse that these cannabinoids are. This is the pharmacological actions of non-psychotropic, not even including THC. Over 40,000 studies show that CBD and the minor cannabinoids can be used to modulate disease. And you can see if you just look at CBD, as psychotic, anxiolytic, anti-epileptic, neuroprotective, helping preserve the nerves from dying and decay, activating PPAR channels, TRP channels, anti-diabetic, anti-inflammatory, the list goes on and on. And that's why these are so powerful.
But THC is important, so that's why we have this beautiful slide here from Cannabis. So this is from the Cannabis research dashboard, where we get a lot of our research that supports our programming and our educational content. So THC is that molecule that everyone gets scared of, right? Because it changes how you feel. It's a multi-targeted molecule that binds with numerous cell receptors, but primarily affects CB1 and CB2 receptors of the endocannabinoid system. And so supplementing with cannabinoids can supplement our endocannabinoid system to bring it back to balance. So Marinol, I just want to bring up, is the synthetic version of THC that was actually approved by the FDA in 1985 for the treatment of nausea and vomiting associated with cancer chemotherapy. The issue with Marinol, though, that a lot of patients have had that have reported to me, is that it causes dysphoria. And dysphoria is a feeling where you do not feel good. It's the opposite of euphoria. So
it's missing the whole plant.
It's missing the whole plant, exactly. So there is clinical evidence for using THC for all of these different conditions. You can see cancer, cancer pain.
Just about everything you might have is on this list.
Is on this list, yes.
And CBD is the same. It's a multi-target molecule that buffers the body, mind, spirit, and it's active at over 70 receptors in the body. It's an allosteric modulator of CB1 and 2, so it's not nudging it the same way as THC is, but it's very promiscuous and prolific everywhere else in the body. Epidiolex is a purified version of CBD that was approved by the FDA in 2018 for rare pediatric seizures that do not respond to other pharmaceuticals. And you can see over 189 clinical trials on CBD and determining clinical evidence for all of these conditions. And, you know, like Sherri said, everything that you could possibly have. I have fibromyalgia, migraines, insomnia, which is all endocannabinoid system deficiency. And some of that for me was genetic, but I'm aging too.
Yeah. So now we're going to talk a little bit about how the endocannabinoid system works for eating, sleeping, relaxing, forgetting, and protecting. And so this is really an interesting concept. Eat, sleep, relax, forget, protect was a phrase that was coined by endocannabinoid researcher Vincent DiMarzo in 1998, and an amazing book by Dr. Michelle Sexton in 2023. So Dr. DiMarzo speculated that the endocannabinoids that we make function as stress recovery factors, and they're all survival based. So our autonomic nervous system is modulated by the endocannabinoids, seeking to balance all the physiological systems in our bodies. So the autonomic nervous system is the system that works automatically without you thinking, and that is controlled by the endocannabinoid system. So the concept of eat, sleep, relax, forget, protect holds significant meaning for health. The endocannabinoid system regulates physiological processes such as mood, memory, appetite, pain, and sleep. And if the endocannabinoid system is working well, we feel good. And if it's not, we don't. And I've actually seen patients, and we're going to talk about this in some of our case studies, that have felt good at the end of life.
Mhm.
Exactly. So we're going to talk about eating right now. So eating and metabolism. So the endocannabinoid system signals everything in the gastrointestinal tract: motility, acid and fluid balance, dilation of blood vessels, nerve conduction, muscle contraction, alerting us when we need to take food. So when patients are looking, and there's a lot of different cannabinoids and dosing formats that can be taken to either stimulate appetite, suppress appetite, or support the gut microbiome. Helpful cannabinoids for the gut. A lot of patients that have nausea, we teach how to inhale just a little bit of THC if they can't tolerate the oils. THC has been really, really good, and inhalation has been a really great mechanism of action to help people decrease that nausea. A lot of patients that have diarrhea, we increase the oils, more of the oil-based, getting it into the gut, because THC can slow down gut motility. Patients that have constipation, CBD oils can help speed up motility. And then again, those that have issues with diabetes or want to lose weight, they can use THCV, CBD, and then get gastroesophageal reflux disease, looking at a combination of CBD and CBG oils. And so the CBD and THC are the major cannabinoids. And when you see CBG, CBGA, CBN, those are the minor cannabinoids that we're talking about. So sleep. We want to think of resting and restoring. So the endocannabinoid system helps regulate our circadian rhythm. And this is our body's internal clock that governs physical, mental, and behavioral patterns over a 24-hour cycle, including sleep-wake cycles. So think about, what is the cornerstone of a good night's sleep? Well, the ease of falling asleep, staying asleep, the deep restorative sleep with the REM dreaming, waking up feeling refreshed with no residual drowsiness in the morning. And so a lot of times patients will come to us and, they think that they need to just take all the cannabinoids right before bed. Well, we'd like to teach on the pleiotropic nature of the endocannabinoid system and how to modulate the stress response in the daytime by using various other cannabinoids such as CBD, CBG, THCV in the morning to promote daytime energy, whereas using a little bit more heavier hand on THC, CBD, CBG, CBN in various ratios and dose formats in the evening. And then we teach stacking multiple cannabinoids in various routes for different effects. So for example, if you have difficulty falling asleep and that's all you have issues with, the quickest way to do that is a little inhalation or tincture. You can do one or the other, or you can do a combination of both. And those patients that have difficulty staying asleep, we look at more of the longer acting dose formats. So edibles, soft gels, capsules. And then if you have difficulty staying asleep, falling asleep and staying asleep, then you might stack a whole bunch of them. And so as nurses, what we do is we help build that toolkit to help you get that rest and restoration that you need. Okay, so here we are, relax, modulating anxiety and fear. So the endocannabinoid system signals both the fight or flight response and the relaxation response. We cannot control the fight or flight response, but we can control the relaxation response with conscious awareness and practice. And stress brings people to cannabis. Anxiety is the #2 reason why people come to cannabis, while pain is #1. And overall, the research shows and substantiates that high CBD, low THC products are the safest and most tolerable options for all anxiety types. Full spectrum CBD has a trace amount of THC in it, is the best starting point. Adding in 1 to 2 milligrams of THC is tolerated. But then again, people that can't tolerate THC, there are a lot of other minor cannabinoids that can do amazing things to help modulate that stress response. So combinations of CBD, CBDA, which is the acidic version, CBG, CBGA, the acidic version of CBG, can all reduce anxiety without cognitive or sedating effects. And again, those people that do need a little bit more THC, CBD may counteract some of the anxiety that may happen. And this isn't with everyone, but some patients are very sensitive to THC. So another cannabinoid, again, that has just come out, new clinical trials, CBG can reduce anxiety. And this is in and of itself in a full spectrum oil. And it helps the endocannabinoid system produce its own anandamide molecule, which I think is really cool. The anandamide molecule is our own bliss-like molecule that mimics THC. So THC is effective at low doses. We like to keep people to start off very low, 2 milligrams, but at higher doses, 5 or above, for sensitive individuals or older individuals, you just need to be very careful. And again, consumers do best with more CBD than THC for anxiety. Anything to add?
No, that's
All
good.
right.
So forget. So this one, we're talking about our CB1, our brain functions. The endocannabinoid system supports learning and memory by activating the hippocampus and the amygdala. It helps us learn, store, recall, and modify our experiences. And our anandamide is active at CB1, always making sure that we're working at our full cognitive abilities. And if we're not having that because we're deficient in anandamide, which happens, we can supplement. And THC is the agonist at CB1. And so most of the time we're talking about using that, but also CBD helps inhibit the FA, the enzyme that breaks down anandamide. So CBD can also help as well, as does CBG. But with THC, that's the main one that we talk about here. But remember, it's biphasic. And what that means is that a low dose, 1 or 2 milligrams, can do an opposite thing from a high dose, 10 milligrams, 20 milligrams. And so that biphasic, there's a sweet spot in there that you can use. So low to moderate THC helps reduce pain at CB1, like turning down the volume on your pain. Low dose THC helps boost memory and cognition. High THC, however, impairs CB1 and working memory, causing that stoned, forgetful feeling. So if that happens, reduce THC and add CBD to balance it out. THC can also help us forget. It's part of sleep when we trim old memories in our brain, making room for new learning in the morning. If you didn't forget anything, your brain would explode. And THC facilitates that, and especially like in PTSD. THC also inhibits acetylcholinesterase, allowing for more acetylcholine, which is our brain-preserving neurotransmitter in the brain, and dementia patients are low in that. THC stimulates BDNF, our brain-derived neurotrophic factor, boosting neuroplasticity for new learning, overcoming fears, phobias, and addictions, and balancing THC with CBD and the other minor cannabinoids help us maximize the benefits, minimize the harms or the risks of THC. And protect, this is our CB2 receptor. Think about the immune system. The ECS regulates the immune system to eliminate anything foreign that is not me across the body. CB2 receptors are highly expressed on 6 cells, basically calling out for balance, for the endocannabinoids to correct cell signaling. The endocannabinoid system is constantly sensing what's needed and sends those messages feedback to restore balance. However, if you're deficient, there are errors in that communication system, which then fails to repair the body, which is why supplementation is so important. The CB2 receptors on immune cells regulate the immune system to fight infections and boost the functioning of the WBCs, and also are anti-inflammatory, reducing our pain by inhibiting cytokine production and suppressing cancer cell proliferation. Cannabinoids act as immune modulators, suppressing or stimulating the immune system depending on need. So pushing the gas, pushing the brake. HIV versus cancer, it's all different things. And so it takes an individual approach always. Multiple cannabinoids found in cannabis, hemp, and nutraceuticals like echinacea, beta-caryophyllene, and PEA can all help activate CB2. And pain. We mentioned that pain is by far the most common condition treated with cannabis at 47%, followed by anxiety and panic attacks at 22%. But it should be noted that people can use cannabis both simultaneously to treat physical and mental health conditions. And 93% of the people that were surveyed in this New Frontier Data survey said that it helped their condition across the board. And remember pleiotropics, right? Somebody with cancer and PTSD could be taking something for pain and anxiety and depression all at the same time and improving sleep.
I thought I would bring up this handy dandy little slide that I got from Cannabis as well. And this just looks at the different pain types. There are 8 different pain types, and it looks at the difference between opioids versus cannabinoids. And the interesting thing is cannabinoids that are THC and CBD have shown high degrees of relief in treating all of the 8 basic types of pain. Actually, cannabinoids are superior to opioids, except for in acute pain. The opioids outrank THC and CBD only in acute pain, such as surgeries and accidents, but we're not meant to be on opioids for longer than 5 to 7 days a week. And no one has ever died from cannabis. So drug overdose is the leading cause of accidental death in the United States. Every overdose death is a policy failure. 91 opioid overdose deaths a day. Every 16 minutes, someone fatally overdoses on opiates. Every 11 minutes, someone fatally overdoses on any pharmaceutical drug, but it's impossible to overdose on cannabis. It's very, very safe to use. And so when we work with patients, we want to teach them how to shop and create their own toolkit. So when we are working with patients in the hospice, palliative care, end of life, we're not only working with the patients, we're working with the families as well. So oftentimes it's a multimodal approach. And so when we like to build a toolkit for the family. And so when you think of the toolkit, you're going to think of multiple different products in different formats. So I want you to think of topicals as outside. Lotions, creams, balms, salves, roll-ons. They do not get into systemic circulation, but they're really great for a local relief. Onset is anywhere from 5 to 15 minutes. Duration can be up to 4 hours. It doesn't get into the bloodstream, so people aren't going to feel high. Then we have the tinctures, which are drops. And I want you to think of your mouth as a sponge. So the sublingual vein is underneath the tongue. We have people drop it underneath, hold it. It's easy to dose, swish it around in your mouth. High bioavailability because it bypasses the gastrointestinal tract going right into the bloodstream. And then what doesn't get into the bloodstream gets digested and metabolized out. Onset can be anywhere from 15 to 30 minutes. Duration can be anywhere from 4 to 6 hours, making it a lovely and this is our #1 product that patients use is tinctures. And second product would be topicals, and then the next would be edibles. And so edibles, think of eating food, right? Capsules, gummies, candies, drinks, butters, baked goods, etc. And they're generally dosed by milligrams. Onset can be a little bit longer, 30 to 60 and sometimes 90 minutes. In the story of my mother, it didn't hit her for 90 minutes. Duration is a little bit longer, 6 to 8 hours. And we always tell people to be cautious with THC because when you are consuming THC orally and it goes through your digestive tract, it actually converts in the liver to a more potent form. And that's why it lasts a lot longer because it's plugging into that receptor to provide that relief that is needed. Then we have inhalation. Now inhalation, a lot of people aren't a fan of it. It's not our primary way of teaching people how to use cannabis, but it is the most popular way that people do use cannabis, and it can be very, very beneficial in circumstances in extreme nausea and for breaking pain cycles. So think of flowers, oils, concentrates. We have joints, blunts, spleefs, pipes, bongs, one-hitters, vape pens, dab rigs, and the dry herb vaporizer. So I call this durable medical equipment. The safest way to inhale is using a dry herb vaporizer. And we teach people how to just take one puff. One puff of a THC cannabis flower can be anywhere from 1 to 2 milligrams of THC. Pause, assess how you feel. Onset is very, very, very fast. Duration doesn't last as long. Duration is 1 to 4 hours, depending upon how many puffs you take. So where do you purchase all of these goodies? Well, we're going to talk about that in an upcoming slide, but cannabis CBD and cannabis THC products need to be purchased at a dispensary, whereas hemp CBD products can be purchased at online retailers or CBD shops. And we have an upcoming slide on safe shopping.
Yep. And so, we talked about the cannabinoids, and generally you find the cannabinoids as blends. They're generally not solo, but they pair up with the other cannabinoids, and the formulators make it into blends. And then these are the routes, the way that you take it into the body. All of these can have potential side effects, but they are dose dependent. Remember that word biphasic, low, high, right? A milligram versus 10 milligrams are going to do different things. CBD, we know quite a bit from the Epidiolex trials. They saw some somnolence, sedation, some high liver enzymes, some diarrhea. But these were, kids were using 1,000, 2,000 milligrams a day. So generally, it's well tolerated. You might see some dry mouth or fatigue, but interactions are not really seen under 100 milligrams a day in divided dosing. And THC, again, this is the psychoactive. This is the one you feel. It can cause changes to that mentation, drowsiness, dizziness, tachycardia, especially in seniors with cardiovascular issues. You want to really minimize THC, and changes to cognition, memory, attention, dry mouth, anxiety, etc. Interactions generally are safe under 20 milligrams a day in divided doses. Most people would never take that all at once, but maybe 2 milligrams or 5 milligrams a couple of times a day. And the side effects could be the desired effect for some people. The dry mouth is welcomed by people with ALS that have drooling. Red eyes is welcomed by glaucoma, where you've got interocular pressure, and munchies and increased appetite. Cachexia and nausea, people are welcoming that. Drowsiness and sleepiness are welcomed by people that have hypervigilance and insomnia. And forgetfulness is good for PTSD, and euphoria is great for depression. And whole plant formulations, microdosing with just a couple of doses a few times a day is the way to go. And then working with a cannabis clinician can help you decrease the potential for any side effects.
So safety with dosing, right? We want to take the lowest dose to get the therapeutic response below the threshold of being uncomfortable, right? Impairment necessarily isn't a bad thing. Euphoria isn't a bad thing, but we want people to feel comfortable with what they're taking. So taking the minimum of effective dose is that Goldilocks dosing or the sweet spot. So we teach to start low, go slow, especially with the THC products. We teach microdosing to mimic endocannabinoid signaling. So you think about the endocannabinoid system is going on and off all day long. So we teach dosing breakfast, lunch, dinner, bedtime, and as needed dosing. And this tends to work well. Choosing primary formulations, so full spectrum CBD rich formulations in the daytime, with the minor cannabinoids and terpenes to boost, THC rich formulations in the evening. And for those patients that need a little bit more THC, 1-to-1 ratio is generally the best. And that's 1 part CBD to 1 part THC. And you'll see this in a dispensary as needed. And then we teach to stack products. We're building a toolkit. Stacking products keeps it cost effective and keeps the tolerance low. So building a toolkit of topicals, tinctures, capsules, gummies, patches, suppositories, there's all different types of things. We teach stacking, and it's going to be individualized to each person. And then there's safety with other pharmaceuticals. We can't ignore that fact. So the majority of pharmaceuticals are metabolized through the liver, through the CYP450 enzyme. And so if you think about any drugs that interact with grapefruit, we always give the dosing suggestion to take your medication first, wait 1 to 2 hours, and then take your cannabinoids. And this has to do with the oils and the edibles, et cetera, not as much as the inhalation. And then we teach patients and consumers how to journal, track results, talk to your provider. We'll talk to your provider if you need to, and then to call the nurse line if you have any questions.
Yeah. And you can support the endocannabinoid system with all of these lifestyle tips, right? Food as medicine is the #1 way, but people come to us trying all of these different things, and it's not until they add cannabis and hemp products that everything else starts working. It's like you have that key in the lock that then can figure out how to open up our body to find balance again. And we take people from crisis to thriving. And you can thrive even at the end of life by having peace and tranquility and time with your family. And so all of these things are good. And I know Dr. Bob and Integrated MD and Empowered Endings practices a lot of these other techniques and providers that are able to help usher in all kinds of healing.
So now we're just going to talk about how do we work with patients, right? You think about the therapeutic cannabis experience working towards optimal consumer outcomes. The patient and the family is sitting right here in the middle. You know, we do look at the science, we do look at the research, we have Cannabis and lots of research studies, but we also want to know, what does the patient want? What's important to you? How do you want to live your life at the end of life? And then we look at real world evidence, looking at the judgment of clinician, the results from trials or the observational work. And when we're working with patients, we're guiding, we're educating, we're supporting, and we do this in multiple different ways. So we have a basic assessment tool plus a holistic assessment. So it's looking at everything, your past medical history, surgical history, medications, et cetera. And then the holistic assessment is looking at all of your lifestyle, all of the things that you're doing or not doing. And then we make recommendations and we do education to support the endocannabinoid system and the endocannabinoid dome, which is the larger environment that interacts with the endocannabinoid system, and how to support that with lifestyle as medicine. It's customizable to each patient. We educate on consumption methods. We help patients and families to choose safely and how to track products. We teach patients how to make adjustments, and we teach on self-titration so people can have the autonomy to do this on their own. So case studies on therapeutic use we're going to get into now. So the therapeutic use of cannabis brings the hope and inspiration for growth and healing across all of the 5 health domains. So the therapeutic use of cannabis is defined as the use of cannabis products for medicinal, wellness, and healing purposes. It is personal and subjective to each consumer, with objective criteria being improvement in one of the 5 health domains: biological, mental, emotional, spiritual, social, without negatively impacting any of the others. So every individual is unique, every family is unique, and so the care that they receive is going to be customized and personalized. And our role as nurses is to customize our education to coach, guide, and comfort patients and their families as needed through the palliative care end-of-life journey. And so I'm going to talk about, this is the first patient. I've done hospice nursing, gosh, way back in the early 2000s. And this was my first hospice patient taking care of him using cannabinoids. So I did a presentation at a hospice center for nurses, social workers, and doctors. And I got a call from the social worker and nurse, saying that this patient had gotten some donated full extract cannabis oil. And they wanted me to come and sit while he took his first dose and to educate them on plant medicine. So this is Joe. He had intractable pain at the end of life. He was given weeks to live. He had stage 4 lung cancer, tracheostomy. He had an oxygen mask. He wasn't vented. He had a G-tube for feeding, taking in, Ensure 2 to 3 cans a day. He wasn't eating much when I met him. He actually had severe whole body pain. So the pain was ravaging through his body. He was on 100 milligrams of morphine a day in divided doses. And so when I went, I had spoken to his sister, who was all on board. They had gotten some donated Rick Simpson oil, or full extract cannabis oil, which is high dose THC oil. And again, they wanted me to sit there and educate them on it. So we looked at the oil, they had a lab result. We talked about that. We talked about the plant. And he took his first dose while I sat there. And the transformation in the hour and a half of that first dose, and in the little pocket under his tongue, was just absolutely amazing. He went from not sitting up and to looking at me and to smiling and to engaging, went to the refrigerator and actually got himself something to drink, which was just amazing. And so we taught him how to dose, just using 2 rice grain sizes of that thick tar Rick Simpson oil twice a day with his morphine doses. And basically he was able to engage with his family, his friends, do legacy work for 2 more weeks before he died. And he passed comfortably in his home without existential angst, and the family was grateful. That was Joe. Marta is actually an interesting patient. That video that you saw at the beginning, this is Marta. This is an amazing story. So I met Marta. This was the same hospice that I had lectured to. I got a call from another social worker, to educate Marta and her family on end-of-life care using cannabinoids. She had stage 4 pancreatic cancer with an unresectable tumor. Chemo and radiation failed her. She was sent home on hospice. She was unable to eat, walk. She had severe pain and insomnia. She was at the end of her life. And, the family was looking for one thing. she was ready to go. And she was just like, I'm okay, Sherri, I'm ready to go. I just want to have a better pain management so I can spend time with my family. You know, she wanted to relieve her suffering of cancer pain at the end of life, get a good night's sleep, and spend time with her family. So we dosed her just a little bit differently. We did the full extract cannabis oil, but only in CBD. So it was high dose CBD, 100 milligrams in divided doses during the day and evening. And then she just did a tiny, tiny bit of the Rick Simpson oil, high THC at bedtime, and then CBD all over her body. And the interesting thing with Marta, which I wasn't planning on, and neither was Marta, was she kept calling me up and she's like, I'm not dead yet, you know? And so I was like, well, just keep doing what you're doing and, you know, let's see what happens. So 5 months later, she called me from her oncologist's office and she said, they can't find the cancer anymore, Sherri. So she came off of some of her drugs and we went on a journey from death and dying to alive and thriving. And so she doesn't take the same amount of cannabinoids. She takes a different formulations now because she's now in remission. But the interesting thing with Marta is Marta's husband also developed cancer and she put him on the same formulation that I put him on and he also received remission as well.
Mhm. So she's still going strong.
She's still going strong.
So Barbara had vascular dementia and pancreatic cancer, severe short-term memory loss, couldn't remember 5 minutes ago at all. Tried hospice at home, day shift with caregivers, rotating family to provide most of the care. She had no appetite, severe nausea, very severe pain, deeply depressed, sleeping most of the day, increasing paranoia due to removal of the dementia RX. And this is, you know, one of the gripes I have with hospice sometimes is maybe that donepezil and that mementing should have stayed because the paranoia and the dementia worsened when they were removed, along with the metformin and things like that. But anyway, the goal was to slow the progression of the cancer. The family wanted her to live and to be able to have that same miracle that Marta had and use the same 1-to-1 CBD THC capsules in the morning and THC tincture, PRN as needed. And she was also taught to use a 1-to-1 CBD vape for severe nausea, which she used successfully and liked that. Topical oil was applied liberally to her sore body and especially legs that were sort of weeping. But after 2 months of the 1-to-1 capsules with the opioids, because the hospice brought in the opioids, she was not taking opioids at all before. The paranoia increased. She was wandering in the streets, telling neighbors that people were stealing from her. Her caregivers were afraid, and she had to move to a memory care facility and died 2 months later, which was hard on everybody. So the warning here is when you have accelerated age, Barbara was 87, and with dementia, you know, you really need to go very easy on the THC if opioids are present. I think that the combination can be hard. However, Lorraine was another client of mine with Alzheimer's dementia, and she came to me on hospice, not eating, hallucinated, agitated, typical Alzheimer's syndromes. And so we started her on a 4-to-1 CBD THC at 9 and 3, and a 1-to-1 tincture in the bedtime. And these were all tinctures. Within a couple of weeks, she was gaining weight. She started to eat almost right away. Her sleep began to normalize. She stopped hallucinating and crying out completely. Her mood changed. They cut the SSRI, the mirtazapine, they cut the Seroquel, and her daughter really wanted her off of that because it carries a black box warning, and she didn't want her mother on that. She even became semi-continent, asking to toilet, and she was 82 as well. She was kissing and hugging people again. She lived well for another 2 years, and her family was incredibly grateful. In fact, her daughter at 60 became a client, and we had her on different cannabinoid formulations. And then the granddaughter, who was about 30, also started using cannabinoids for her best health. And I was helping the 3 generations in this family, and it was just wonderful.
So, and this is what we do. You know, we not only just take care of patients, but we take care of families as well. So who is caring for you? The caregivers. We're here for you too. How to use cannabinoid therapeutics to care for you, how to take care of your mind, body, and spirit, how to cope with frustration and have patience, how to have empathy, how to work through grief and loss, how to build resiliency, how to de-escalate situations, how to create a reliable support system, how to shift, pivot, and adapt with ease. Cannabinoids can be facilitators for you too as the caregiver.
Yeah. So Ryan's Law, this is, bringing this into facilities. If somebody is in a hospice or palliative care facility, Ryan's Law passed in 2021, SB 311. It requires healthcare facilities to allow the use of non-smokable medical cannabis on their premises for terminally ill patients who have a medical identification card. Terminally ill is a year less to live. And healthcare facilities, licensed general acute care hospitals, special hospitals, skilled nursing, congregate living, or hospice facilities. And this is Ryan. Ryan Bartel was a 41-year-old gentleman with pancreatic cancer, stage 4. He spent 4 weeks in a palliative care wing of a hospital using fentanyl for pain, and he was miserable. They would not allow Ryan to use his cannabis, which he was using previous to that. They moved him to another hospital that would allow him to use cannabis, and he spent his last 2+ weeks lucid and pain-free with his family and friends. Ryan's dad, Jim Bartel, made it his mission to ensure that no other family would lose precious time with their loved one, and Ryan's Law builds on patient rights granted through Prop 215 that passed in 1996, the Compassionate Use Act, that kicked off medical cannabis programs nationwide.
And guess what? It was successful. These are outcomes that speak for themselves. So between May of 2022 and June of 2024, 8 patients at the University UCLA accessed medical cannabis under Ryan's Law without a single reported safety incident. And so nurse satisfaction surveys did reveal that 88% believed that cannabis improved symptom relief, 62% felt comfortable implementing the policy, and all noted cannabis use was most effective for anxiety, sleep disturbances, and pain management. And these numbers represent more than just data. They reflect the human impact of compassionate policy translated into clinical practice. And we need all hospitals to implement Ryan's Law.
I have a dream.
I have a dream.
So where can you buy safe CBD, right? Green Nurse Approved is sort of a catchphrase that we have. But cannabis CBD is 0.3% or greater THC, and that's found in dispensaries. And that's where you can also find a 1-to-1 CBD or 4-to-1 or any of the other ratio products we discussed. Hemp CBD is less than 0.3% THC, and that's found online and in hemp CBD boutiques. And there are different types: isolate, broad spectrum, and full spectrum, depending on the percentage of THC in there. And then you want to do business with a company that has transparency, a working website, address, email, phone, customer service. GMP, good manufacturing practices, is always preferred, and certified organic is the way to go. You want lab tests, the certificate of analysis or the COA that testifies to the purity, potency, contaminants that are removed, residual solvents that are out. And then labels. Somebody says, take a dropper a day of this. Well, is that dropper 10 milligrams or is that dropper 100 milligrams? The potency of these bottles vary widely. So you have to know what that is to calculate your serving size and have safe dosing. And that's what we do. You can call our free nurse line at 970-404-HOPE to get started, and visit Bloom.
And then Bloom. So a little bit more about Bloom Hemp CBD. So Bloom Hemp is woman and nurse owned, USDA organic hemp CBD. This is the online CBD shops that we're talking about. This is ours. Doctor and nurse formulated. We had an Ayurvedic doctor, Dr. Sunil Pai, in New Mexico, created our formulations. Elisabeth and I created 4 more. Ayurvedic inspired products, symptom targeted formulas. We have a free nurse line. We have a pharmacist on staff that is available to answer questions when we're not. Free emailed care plans. So this little flower here is an intake form, is a QR code that you can actually scan with your phone, and we will send you, if you scan this, you fill out the intake form, and then we will get that, and within 24 to 48 hours, we will send you a customized care plan with hugs and nugs of information and products at Bloom Hemp to get started. We also have a savings code, Senior20, for 20% savings on all of the Bloom Hemp products in the shop. And we also have a free network to support education and learning.
And we also have a free medical cannabis guide. It's a 7-page guide, talks all about the cannabinoids, the endocannabinoid system, the different routes, different dosing, and a little bit more about the history of things that you can get if you click this QR code right here. It'll take you into holistic caring, where we practice patient-centered care. Sign up to receive our newsletter, stay up to speed on what we're doing, our activities, our webcasts, our podcasts, and that sort of thing. And you can get your free guide right there. And then please join our network. We have a free network, and you can click that QR code right now with your phone. Goes in, and all of our programs are in there. We've got a free introduction to cannabis program, a free ABCs of CBD, where we break down each cannabinoid in much more depth, a free patient portal to connect and chat with your peers, a free monthly plant medicine support group, clinical conversations, webcasts and podcasts, and our patient programs, which are targeted e-learning, right? So cannabis and cancer, cannabis and dementia, cannabis and autism, epilepsy, mental health, etc. And then our professional training programs and mentoring, where we train healthcare professionals, and all nurses can get CEUs. We have a cannabis nurse health coach program with 30 CEUs for all nurses, but all clinicians can come. We have several doctors in there as well. And then call the nurse line if you have any questions.
And then finally, you can ask the green nurse. Info@bloomhemp.com or info@holisticcaring.com. You can submit your questions and I may write about it. So what I've been doing is I reply to every single email that comes and answer your questions, but some of the emails are very educational in nature. So I have chosen to start writing about them. So I have a blog on Substack called Ask the Green Nurse, and you're all invited to participate in that as well.
You can read right there. Okay, so we are, look at that, 59:55. We did it.
We did it.
We
Good
did.
stuff, Cher.
Yeah, so that was our 1-hour presentation, and now we are here for some Q&A, and it's just a pleasure to see all of you.